Hello, this is Dr. Booth. I am happy to have you join the class. That means that you have graduated out of Part 1 and now you're entering Part 2. I am happy to have you here, and I want you to know that it will be smooth sailing when you follow the directions of studying, how to get yourself into that mode of studying. You will be doing fine. Remember, you have to have a 70 or better to pass the quiz or test, and that's on the first try. You have to pass it on that first try, and you can do it. You can do that. Now, just to go over certain things that you need to study, I'm quite sure that's how you did before, but I want you to know to be successful, you must read, write notes, and study to know the material. Most importantly, you need to know your objectives, key terms, and abbreviations. The key terms are the definitions. The key abbreviations are just some of the words that are broken down short so you don't have to say the whole term or the whole word. Know your skills. Check skills packet to see which skills go with which chapter. Also, you want to focus on communication, types of anything, signs and symptoms of anything that they discuss in the chapters. Focus on her rehabilitation. Make sure you check all the boxes and tables and view all the figures within that chapter that you are studying at that time. Dedication guidelines you need to know. Review promoting safety and comfort. Review residents with dementia. Review procedure. Review caring about cultural. Teamwork and time management is important. Time to reflect. And the last, of course, is the quality of life for our residents. And the very last thing will be to review the questions. After you have studied and read and taken notes, and you should be ready to take the chapter's quiz. And I want you to take each question and then go to the back and check the answer. Do not check that answer before you take that quiz, the chapter review questions, okay? Okay, so now what we're going to do is get into the meat of this chapter of the residence unit. We will go past the contents because I know you can read that, and I've just told you what all you need to know in each chapter. And so we're going to go straight into it. Personal space, furniture, and equipment provided for the person by the nursing center. The person's rooms or areas of the room is private. It is treated like the person's home. The intent is to have resident units as personal and home-like as possible. The nursing centers are designed to provide comfort and safety and privacy. Some residents have private rooms, others share a room with another person. A resident unit is the personal space, as said before, like with their furniture, equipment provided for the person by the nursing center. Residents are also allowed to bring some furniture and personal items from home. As space allows, the person chooses where to place the personal items. This really helps promote their dignity and self-esteem. A resident cannot take or use another person's space. Doing so violates the other person's rights. Comfort, the temperature and ventilation of the room. Most healthy people are comfortable when the temperature is 68 to 74 Fahrenheit. Older and chronically ill persons may need higher temperature. The OBRA, the OPRA, requires that nursing centers maintain a temperature range of 71 to 81 Fahrenheit. That's a hint, hint. When I know something that you might see again on a quiz or test, you need to know that and make sure you know those numbers. And you might even see it, might not see it on our test, but you might see it on the state board, okay, on that state exam. So the age and illness and activity affect comfort. Temperature, ventilation, noise, odors, and lighting are also factors. They are controlled to meet the person's needs. Heating and air conditioning systems maintain a comfortable temperature. The comfort, again, to protect persons from drafts. Make sure they wear the correct clothing. You don't want to put winter clothes on when they in the summertime. However, there are some of them, the older people, their body temperature is lower than ours. Their temperature kind of flipped, kind of reversed, where 98.6 is normal. Now they're 96.8. So as you can see, they dropped down and kind of reversed the numbers around. And so they might need a shawl or something to wear. Offer lap robes to those in chairs and wheelchairs. Provide enough blankets for warmth. Cover them with bath blankets when giving care. Move them from drafty areas. Good nursing care, ventilation, and housekeeping practice help prevent odors. Smoke odors present special problems. Persons who are less active usually do not like cool areas, nor do those who need help moving about. Stale room air and lingering odors affect comfort and rest. Ventilation systems provide fresh air and move room air around. Drafts occur as air moves. Older persons and those who are ill are sensitive to drafts. Review the actions for reducing odors listed in the textbook. I knew a nurse who smoked, and she used to have a spray bottle that had lavender fragrance in it, and she would spray one spray on the front of her uniform and kind of try to get the back when she would come back in from smoking, and it worked. It was really good. And she said she always did that to help with the clients. So if you smoke, follow the center's policy. Practice hand washing after handling smoking materials and before giving care. Give careful attention to your uniforms, hair, and breath. You know, always carry some men around with you. Residents, visitors, and staff smoke only in the areas allowed. The center is the person's home. Keep it free of unpleasant odors. Noise control. The Centers for Medicaid Services, CMS, requires comfortable sound levels. A comfortable sound level does not interfere with a person's hearing, promotes privacy when privacy is desired, allows the person to take part in social activities. To decrease noise, control your voice, handle equipment carefully, do not bang it all together and dropping everything, keep equipment in good working order, answer phones, call lights, and intercoms promptly. Also, many older and ill persons are sensitive to noises and sounds. Common health care sounds may disturb them. People want to know the cause and meaning of new sounds. This relates to safety and security needs. Residents may find sounds dangerous, frightening, or irritating. They may become upset, anxious, and uncomfortable. Nursing centers are designed to reduce noise. Window coverings, carpets, and acoustical towels absorb noise. Review residents with dementia, noise in the textbook. Review focus on communication, noise in the textbook. Okay? Lighting. The CMS requires comfortable lighting. Comfortable lighting lessens glare, allows the resident to control the intensity, location, and direction of light, allows persons who are visually impaired to maintain or increase independent functioning. Good lighting is needed for safety and comfort. Adjust lighting to meet persons' changing needs. Always keep light controls within the person's reach. Good lighting is needed for safety and comfort. Glares, shadows, and dull lighting can cause falls, headaches, and eye strain. A bright room is cheerful. Dim the light is needed when someone is trying to relax and rest. Review residents with dementia and lighting in the textbook. Room, furniture, and equipment. Furnished and equipped to meet basic needs for the individual. such as comfort, sleep, elimination, nutrition, hygiene, activity, equipment to communicate with staff and family and friends is included. The bed. The bed have electrical and manual controls raised horizontally to give care, and also is lowered in the lowest position lets the person get out and get in the bed with ease. The head of the bed is flat and raised in varying degrees. Electrical beds are common. Controls are on a side panel, a bed rail, or the footboard, and some controls are handheld devices like ours is on our bed. Manual beds have cranks at the foot of the bed. The cranks are pulled up for use and kept down at all times. Cranks in the up positions are safety hazards, which you can bump into them, cause a bruise, cause open sore, laceration, depending on how hard you hit it, how fast you were going. So always make sure they are put down. Make sure they're kept down at all times, except when you're cranking and automatically put it down. The lowest position lets the patient get out of the bed with ease. Review promoting safety and comfort the bed in the textbook. Bed positions. Flat is the usual sleeping position, and that's with the head of the bed flat. The position is used after spinal cord injury or surgery and for cervical traction. The Fowler's position is a semi-sitting position. The head of the bed is raised between 45 and 60 degrees. And hint, the half Fowler's position is a semi-sitting position. The head of the bed is raised 60 to 90 degrees. All the positions, you need to know the degrees of how you raise how far you go up with it to be a certain position. Okay. In semi-phallus position, the head of the bed is raised at 30 degrees. In Trendelenburg's position, the head of the bed is lowered and the foot of the bed is raised. This requires a doctor's order for this position, so never put them in this position. In reverse Trendelenburg's position, the same, where you have to have an order. The head of the bed is raised and the foot of the bed is lowered. Okay, so make sure you follow the directions on this. Identify the person at risk for entrapment in the hospital bed system. Identify hospital bed system entrapment zones. Okay, so we need to know that. The person can get caught, trapped, or entangled in spaces created by bed rails, the mattress, the bed frame, or the headboard or footboard. Bed safety involves the hospital bed system. The Food and Drug Administration, FDA, defines the hospital bed system as the bed frame and its parts. The parts include the mattress, bed rails, head and footboards, and bed attachments. Entrapment within parts of the hospital bed system is a risk. Also, serious injuries and deaths have occurred from the head, neck, and chest entrapment. Arm and leg entrapments also occur. So you have to be diligent to make sure the person is positioned in the bed correctly, and make sure they don't have any parts in between the rails when you leave the room. So just be diligent to know to look out for different things like that. Bed safety. Persons at greatest risk of entrapment include those who are older, are frail, are confused or disoriented, are restless, have uncontrolled body movements, have poor muscle control, are small in size, are restrained. You may feel that a person is at risk for entrapment. Report your concerns to the nurse at once, immediately. Also, always check the person for entrapment. If the person is caught, trapped, or entangled in the bed or any parts, try to release that person, and also still contact the nurse immediately. In zone 1, within the bed rail, that is when they are within the bed rail. That's zone 1. Zone 2 is between the top of the compressed mattress and the bottom of the bed rail and between the rail supports. Zone 3 is between the bed rail and the mattress. You have the figures that you can see with this. They are from 16 to 1610, 1611. You can see how the different entrapments to each zone. Zone 4 is between the top of the compressed mattress and the bottom of the bed rail and at the end of the bed rail. The other 3 zones are 5. Zone 5 is between the split bed rails. Zone 6 is between the end of the bed rail and the side edge of the headboard or the footboard. Whereas Zone 7 is between the headboard or footboard and at the end of the mattress. So review chapter figures 16, 10, and 11. And make sure, remember to call that nurse if they are entrapped. Call for help. Unit furniture, the overbed table placed under the bed by sliding the base under the bed, raised or lowered for the person in the bed or in a chair, used for meals, writing, reading, and other activities. Bedside stand used to store personal items and personal care equipment. The chair or chairs, at least one chair for personal or visitor use, must be comfortable and sturdy, must not move or tilt during transfers. Person should be able to get in and out of the chair with ease. The nursing team uses the overhead bed as a work area. Only clean and sterile items are placed on the table. Never place bedpans, urinals, or soiled linen on the overbed table. Clean the table after using it for a work surface and before serving meal trays. The top of the stand is often used for tissues and other personal items. Often residents bring their own oral hygiene equipment, hair care supplies, and deodorant. Respect the person's choice in personal care products. The chair is usually upholstered with arm rests, and the nursing center residents may bring chairs from home. For unit equipment, privacy curtains, the OBRA and the CMS require that rooms be equipped and designed for full visual privacy. Extends around the bed. Always pull the curtain completely around the bed before giving care. Personal care items used for hygiene and elimination. Bedpan and urinal are provided. The center may also provide other essential things like the wash basin, kidney basin, water pitcher, cup, soap and soap dish, powder, lotion, toothbrush and toothpaste, mouthwash, tissues, and comb. Often residents bring their own. A full visual privacy is having the means to be completely free from public view while in bed. The privacy curtains help provide full visual privacy. Rooms with more than one bed have a privacy curtain between the units. Privacy curtains prevent others from seeing the person but do not block sounds or voices. Remember that. Others in the room can hear sounds or talking between the curtains. Don't think the curtain is going to block your sound. Often residents bring their own oral hygiene equipment, their hair supplies, and deodorant. Some also prefer their own soap, lotion, and powder. Respect the person's choices. The call system allows the person to signal for help when using an intercom and remember confidentiality. Some people cannot use call lights, so you have to make sure that you check the care plan for special communication measures. Check these individuals often. To promote safety, you must keep the call light within the person's reach. Place the call light on the person's strong side. Remind the person to signal when help is needed. And sometimes you have to remind them often because they might forget. After you have being able to get up and just walk and start walking without any help, sometimes the residents might forget that and get up and just go on and fall. So make sure that light is there. Make sure you tell them to use the call signal light before you leave the room. Answer call lights promptly. Answer bathroom and shower, tub, room light, call lights at once, immediately. The CMS requires a resident call system when in their rooms, using the toilet, or in the bathing area. Residents must be able to contact the staff at the nurse's station. An intercom system lets the staff talk with the person from the nurse's station. The person tells what is needed. The call light is at the end of a long cord. You can see that in figure 1614. It connects to a light panel or intercom system at the nurse's station. Some call lights are turned on by tapping with a hand or fist. They are useful for persons with limited hand mobility. The person is taught how to use the call system when admitted to the center. Some people cannot use call lights. Examples are people who are confused or in a coma. The care plan lists special communication measures. Check these persons often. Review teamwork and time management, the call system, and review the focus on communication, the call system, in the textbook in chapter 16. The bathroom, standard equipment, toilet, sink, call system, mirror, may include shower, safety measures, grab bars, raised toilet seats, call light next to the toilet. Make sure that all these are intact. All resident rooms must be equipped with or near toilet facilities. Many centers have a bathroom in each room. Some have a bathroom between two rooms. The person uses grab bars for support when lowering to or rising from the toilet. Higher toilets make wheelchair transfers easier. They also are helpful for persons with joint problems. Towel racks and paper towels, soap, paper towel dispenser, and a wastebasket are in the bathroom. They are placed within easy reach of the person. When the bathroom call light is used, the sound at the nurse's station is different from the call lights in the rooms to alert the staff that the person is in the bathroom. Someone must respond at once when a person needs help in the bathroom. This is a must. Okay. Closet and drawer space. Each person is provided with closet and drawer space. The closet space must have shelves and a clothes rack. The person must have free access to the closet and its contents. Other equipment, furniture, and small items from home, like televisions, radios, clocks, photos, wall-mounted television, phones, and intercom access may be available. Quality of life. The center is the person's home. A home-like setting is important. Personal choice is always allowed in arranging items. The health team must help the person feel safe, secure, and comfortable. Everyone involved in the person's care must keep the unit clean, neat, safe, and comfortable. OBRA and the CMS serve to promote safety of life. Make sure you go over the end of the chapter question review questions, and that is the end.